Hi, Jan at JDK Counseling. I hope you're all doing well. Today I want to continue my series on various emotions, and I want to talk today about shame and guilt. Shame and guilt are two different things, but we often use those words interchangeably, and I think it's important to understand what they mean because they are different. Guilt is a normal feeling of discomfort that we experience when we have done something objectively wrong. We start to learn this association and this feeling of guilt. Start to learn it at around age 3 and understand gradually more as we approach age 5, 6, and 7, where we can think a little bit and give verbiage, words to what we've done or not done. But we start to learn around age 3 that hitting someone and taking their toy is wrong and that there are consequences for doing that. The good news about guilt is that guilt allows us to, as of course, as we get older, to think about what we've done, to make amends for it, to say I'm sorry to the person. Um, if we've stolen or done damage, to pay back what we've done, somehow to make amends for the thing that we have done wrong. And guilt is about the thing that we have done wrong, not ourselves. Shame, on the other hand, is an intensely personal experience. And shame is about the person themselves being fundamentally flawed or not good or not worthy or sinful or somehow less in their very being. And we can start to learn and internalize this feeling of shame as early as 15 months old. And it's a lot harder to work with shame, especially if we've grown up in a situation where we have been shamed. Um, you know, some people have grown up with the phrase shame on you, or you bring shame to the family, or what you did is shameful, or you are a shameful person. Shame is an internalized feeling that says there's something inherently flawed with just the way we are, rather than the thing we have done is wrong. And because it often starts as such an early in life experience, it gets wired into our brain and it is harder to heal. It takes, oftentimes, it, it takes help of a therapist, perhaps a pastor who understands, um, maybe even a close friend. But shame is a deeply personal experience, and it we have to learn self compassion. We have to learn kindness for ourselves. We learn to sort of treat ourselves as we might treat others who have done something, and we wouldn't shame others. And sometimes we have to learn how to have the same compassion for ourselves as we might for others that we care about. Um, Shame can also affect us in how we'll approach relationships, what kind of relationships we will have, whether we're going to have healthy boundaries in relationships, even how we pursue jobs or what kind of job we might accept, the kinds of treatment that we'll accept from other people because of the inherent sense of worth that we've been taught. So shame can get really complicated, and like I said, often needs the help of a therapist or someone who really understands the difference between shame and guilt. If you're struggling with that sense of shame, or I'm not worthy, I'm not good enough, I'll never be good enough, consider talking to someone like me. Reach out to your doctor and get a referral to a therapist. Shame can be healed, and it's important that we take steps to do that. I hope this was helpful. If you need to reach out to me, I'm in the state of Wisconsin, and my email is jan@therapysecure.com. Please share this with anyone who might find this helpful just to understand possibly some of what's going on inside of them. Take good care, everyone. Talk soon.